Welcome to Wellness Made Easy. Today, Larry is joined by Dr. Bob Martin, host of America's largest weekend syndicated health talk show, reaching over 500 radio stations nationwide. Have you ever wondered what those unsightly veins, spider veins, varicose veins, or even swollen ankles, are really telling you about your health? Could there be safe, natural ways to support your circulation and avoid risky procedures? Stay tuned as Larry and Dr. Bob dive into powerful insights that could change the way you look at your vascular health.
Our special guest joining me is Larry Logsdon. He is a functional food researcher specializing in the medicinal properties and benefits of exotic fruits, particularly noni juice. Larry founded Tahiti Trader Noni Juice Company back in 1998. I invited Larry to be a guest on the show today to discuss the topic of what your unsightly veins indicate and how to help them drug-free. Because there are people who look at this and go, oh, I don't like that varicose vein. I think I'll go in to the doctor's office and have them destroy it by a laser or burning it up or doing some medical procedure to get rid of it without respect to actually what the cause of it is. In other words, the equivalent of painting over termites or putting frosting on burnt cake. You still have the problem underneath that. You haven't addressed that. We're going to try to address that because they mean something. When I say they, I mean varicose veins mean something is going wrong in your body. Spider veins are an indication that there's a problem. Venous insufficiency, as in President Donald Trump's swollen ankles. Hemorrhoids, they all are an indication that something is interfering with the proper function of your body. And there are, several related names that you can call these things. Doctors have to have a diagnosis, whether it's enlarged veins or varicosities or hemorrhoids or, whatever. They have to have a diagnosis in order to get paid, but it doesn't really address the underlying reason why you have it, the imbalance, the weakness that your body is suffering from, and we're going to try to get to that. The good news is there are safe and effective science-based ways to help prevent and reduce these circulatory problems that a lot of people just sort of shrug off and utter the 5 dangerous words. Maybe it will go away, and it never does, and it gets worse, and then they finally end up in a crisis management situation with a leg ulcer or needing some amputation down the road because now they're infected, now they have a staph infection, and they can't get it under control. We don't want any of that, and that's why we offered and asked Larry Logsdon to join us today. Larry, welcome back to the Dr. Bob Martin Show.
Good morning, Dr. Bob. How are you today?
I'm doing fantastic. Just came back from a hiatus on a big cruise with my lovely wife, you know her, of 50 years. And I was telling Dr. Brockman, oh man, because he is, after all, the co-host of the show and the executive director and of all content on the program. I said, you know what, Dr. Brockman, I could get used to this. And, I was sort of monitoring his work and the job that he did in my absence. And I'm telling you what, Larry, he hit the bullseye. This guy, it took me a long time to find the right doctor to step into my shoes on this radio show. You cannot believe how many doctors I looked at. I looked at their background. I looked at their demeanor, their delivery, their commitment to healing. And I found him. His name is Dr. Adam Brockman, and I know that you have already had a conversation with Dr. Brockman yourself, and it sounded like it was positive.
It was very, very good. In fact, I'm calling him the new Babe Ruth of the Dr. Bob Show.
He's knocking it out of the park. Yeah, I love it. Yeah, that's good. All right, Larry.
Going out into the parking lot.
Yeah. Well, we want to hit a home run during our conversation today for our listeners. We can quit bragging on Dr. Brockman already, but we need to get to this topic. Why are veins in the human body? Everybody knows what veins are. They've heard of veins in the human body. Why are they so critical, Larry, in your opinion, to human health in the first place?
Well, Dr. Bob, veins carry the blood back from the heart to the heart and lungs after they've been expended. And this is an important thing. It's like 60,000 miles of this stuff in your body.
Wow.
And most people are not paying attention. This is why it is you need to be active and moving around, because when you're sitting or standing too long, these vessels get backed up. That's the problem. And, that tells me that if you're seeing, spider veins and things like that coming up, you need to do something about your cardiovascular system now.
Yeah, your body is crying out for help when it sends a message to the surface, an idiot light in the form of a spider vein or a varicose vein or some bulging vein or a hemorrhoid in your bum. It's crying out for help. Now, you can rub some Preparation H on that baby in the bum and it, temporarily, it may shrink it a little bit, but it doesn't really address the reason for the problem. That's what I want to get to here in this conversation for those people who have circulatory problems. And maybe we can get a copy of this interview off to President Donald Trump, because they're now saying that he has venous insufficiency, chronic venous insufficiency, which means his vein system, his circulatory system is not pumping the way it ought to. It's shutting down, and gravity is not his friend right now, Larry. In other words, the blood supply through his veins are going to his lower extremities, and it's not coming back up the way that it should or the way that it used to. It is coalescing in his ankle area and bulging out through his socks. And there it was. A reporter happened to take a shot of it because, let's face it, he's under the microscope every day, the poor man. And
that's what McDonald's and Coca-Cola will do for you, Doc.
Well, you really opened up a can on that one, which we will get into. Ladies and gentlemen, don't miss this conversation. We're going to address your spider veins, your varicose veins, your venous insufficiency. We hope you don't have them, but if you do, you'll know what to do after this conversation. I'm Dr. Bob Martin. Now, we have a special guest we invited on the program today, Larry Logsdon, a functional food researcher, author. He's here with us to discuss the topic of circulatory problems, circulatory challenges in the form of everything from hemorrhoids to varicose veins to spider veins to what President Donald Trump is being accused of having right now, chronic venous insufficiency, where his ankles are swollen. And we want to cover these topics as much as we can and give you hope if you have them. And so please stay tuned. Now, Larry, let's get back to this conversation. What is the most common vein-related health challenge that you're aware of, and what is the prevalence of it here in America today?
Well, the biggest health challenge is moving. Most people don't move enough, and this is really why the system, the machine, isn't working properly, because it's not getting enough use, really.
Mm-hmm. So, but I read somewhere that varicose veins is the number one vein-related problem. Am I accurate on that or not?
You are. In fact, I understand it affects somewhere between 23 and 40% of the U.S. population.
Whoa.
It's an amazing thing. It's incredible.
Nearly 50% of the population, you're saying, has some level or will have some level of varicose veins.
Mm-hmm. Mm. Yeah, mostly women. Men get it too, but mostly women.
Mm-hmm. Mm-hmm. Well, how are varicose veins typically managed from a medical perspective?
Well, the doctors will start off with doing some kind of compression therapy that they think is going to help out a little bit, help move the blood. But unless you're moving, it really doesn't help you all that much. The best thing I know to do is get people moving through exercise, like walking, doing calf movements, leg raises, the basic stuff that gets your body moving. The biggest thing, though, is losing some weight, getting the weight off your body, and get those legs up and avoid prolonged sitting or standing. This will knock you out fast, Doc.
Mm-hmm. Well, medical care, when it comes to these issues of spider veins, varicosities, the venous insufficiency, they have they have answers within, mainstream conventional medicine in the form of they like to do injections, saline injections straight into the veins. They like to do lasers. There's new laser therapies out there. There's even stripping and surgical procedures that they do. But agree or disagree with me, Larry, it doesn't really hit the mark. It doesn't really get to the cause of the problem. It certainly kicks the can down the road. Would you agree with that?
Oh, yeah, it's a big foot for the can. Move it down the road a little further, and let's not worry about the problem. Let's go ahead and put a little Band-Aid on it, and it'll look okay for a while. And therein lies the problem, because the pain and the swelling and the bruising continues, and the problems that are going to come from that are going to continue, such as infections and bleeding and all kind of problems that, are going to happen if you're going to go down that route.
Now, I've known many patients who, before they entered into my office in the past, had gone into their doctors and had received some type of injections and other invasive forms of care for varicose veins and surgery. What are some of the risks that are known if somebody says, look, all I want to do is go in and get this taken care of? I don't want to know what caused it because I don't want to change my ways. I don't want to drop the 40 pounds that I've gained. I don't want to get off the couch. I don't want to stop eating those potato chips and drinking that Coca-Cola, so I'm going to go in and just get it taken care of at the doctor's office. What are some of the risks of that kind of an attitude when they place themselves on the chopping block in the medical care in terms of treatment for these vein-related problems?
Well, my mom had that procedure done years and years and years ago when they didn't know any better. And they did some vein stripping. And it was the most painful thing she'd ever been through, worse than childbirth. It wouldn't go away. It took months and months and months to resolve. And when she got through, her legs looked like she'd been through a battle axe. It's just not a good thing, folks. Now, they'll tell you, everything's going to be okay. But I want you to know how to spell LIE. That's what it is. It's not the truth. The truth is they don't know how it's going to come out. And so be aware of that when you go in, because next thing you know, you might find yourself with blood clots as a result. Not a good thing.
Well, look, every healing art has its limitations, and that's for sure. I mean, doctors are trying to do their best. It's just they're limited with what they can do because it's sort of like, that's what they're taught. And sometimes it's the old garbage in, garbage out. So are there lifestyle? And I know, Larry, and I want to let our audience know that you brought a testimonial along with you today regarding a person who has been using natural means to deal with her circulatory problems vis-a-vis using and drinking therapeutic amounts of Tahiti Trader Noni Juice. And we'll get to that testimonial soon. But I want to ask you also, are there lifestyle modifications? And be specific here. Lifestyle modifications, dietary changes, therapeutic nutritional augmentations capable of resolving vein-related problems, those that we mentioned already, varicose veins, spider veins, just bloated veins, or even this venous insufficiency that President Donald Trump has contemplated to have here, according to certain doctors?
Well, the answers are absolutely yes. First thing, folks, you want to look at is lose the extra pounds. Start walking at least 30 minutes a day. Do some sort of leg elevation every day for 15 to 30 minutes to get the blood moving around. It's a big, big deal. Avoid long periods of sitting or standing. That's what's going to knock you out. Don't sit around and watch all the I Love Lucy's. Get up and move around. This is very, very important. If you need them, there's compression stockings to help you out. But the most important part of this is going to be in your core strengthening. This is important because, folks, if your body isn't strong in the middle, it's not going to be strong at the lower end either. And, of course, hydration plays a big role. A lot of folks who've had these problems don't get enough water. And, these are things you need to pay attention to. Let's talk about food. I mean, we need to get the right kinds of foods, anti-inflammatory foods, like berries and citrus fruits and dark leafy greens and, beets and garlics and onions and all the good stuff, and get away from the McDonald's. It's going to knock you out. And the sugars. get away from it, because that's what the president's dealing with. And stay away from alcohol. It's definitely not on the list.
So it sounds like it's your belief that a lot of these vein-related problems, a lot of these circulatory problems, are really brought on by ourselves. I mean, we all have, I guess, the propensity to break down in some way or another, and some people are stronger in certain areas of the body and other people are weaker in certain areas of the body. But it sounds like it's your belief that we are in mostly control of all that if we can just get the proper education, which we don't in the sick care system here in the U.S., because all we do is treat symptoms rather than causes, and that once we get to these lifestyle modifications and causes, we'll be a lot better off. Larry, when we come back from this break, I want to play a testimonial that you brought to the table here. Our special guest, this segment of the program, is functional food researcher and author Larry Logsdon. He's also the CEO of Tahiti Trader Noni. And I asked Larry to be on the show today to discuss a very important topic related to circulation, vein-related problems. This has come up in the news about a week or so ago, and it reminded me that a lot of people have circulatory problems, including varicose veins and spider veins and venous insufficiency and hemorrhoids, all of which are circulatory problems, all of which are vein-related challenges that ought to be addressed, because they can end up in, well, very bad situations. We don't want that. And so Larry Logsdon is an expert in this area about helping improve circulation via something very safe, something very naturally. And before we get back to the conversation with Larry, I just want to play a testimonial that Larry sent over to me prior to the program, which really spells it out. This is a lady by the name of Karen who took it upon herself to address her circulatory problems in a safe and natural way. Wait until you hear this. Here's Karen. Go.
Hello.
Hello, Karen.
How are you?
I'm good, Karen. How are you doing this morning? Well, I hear you've been enjoying the Noni juice.
Well, yes, I have.
So how long have you been drinking Noni juice, do you think?
Over 25 years.
Wow. How did you get started drinking Noni anyhow?
When the Mirinda company first issued it, a friend of mine told me about it. I thought, okay, I'll try it. I was having some issues with varicose veins. I started to take the Noni, and I couldn't believe it. In fact, I thought it didn't actually, well, it wasn't true, but I thought that my veins got less painful and also receded in size. I ran out of it during between Thanksgiving and Christmas, and I thought, well, I'll have to wait until the new year to order some more. In the time that I was off of it, the pain and the distension returned, and I couldn't believe it. And so I have been on it religiously ever since. I have noticed that it not only helps with the veins, but it also seemed to prevent me from kidney stones, because when I ran out of it again, I had some kidney stone issues. And as soon as I got back on it, that passed. Whenever I have a lapse in taking it, which is rare, because I do it pretty religiously, but it's usually some sort of an unforeseen circumstance, I realize the body aches and pains and benefits that that it gave to me and overall for many, many years.
Wow. But that's very, very amazing. So you're feeling a lot better, huh?
Yes. I'm functioning better than most people my age. And so, and I think that the Noni is a big contributor to that. I would not be without it.
Well, that's what I strive to do, Larry. I want to function better than anybody in my age bracket and younger. That's what my goal is all about. She's doing the same thing I'm trying to do, and that's to stay healthy. Larry, that was an amazing interview that you just did with Karen. Congratulations to you on the interview, and congratulations to Karen on the hurdles that she has been able to overcome with the consumption of Tahiti Trader Noni Juice. Now, I can understand the circulatory problems because I see the science-based activity associated with Noni Juice, but some of the other effects amaze me as well, Larry.
Well, Dr. Bob, noni is a COX-2 inhibitor. So you're going to find that it's going to help the inflammation, which is probably what she noticed. And that leads to reducing the pain, which, again, she noticed. And then the part with the kidney stones, that's another subject. We'll have it after the break.
Exactly. Yeah, we'll have to talk about that. I had no idea Tahiti Trader Noni Juice could help with that. We'll be right back. I'm Dr. Bob Martin. We've been talking about the medicinal and therapeutic value of drinking and consuming Tahiti Trader Noni Juice. Just so you know, it is available at all GNC stores nationwide, Vitamin Shop, Sprouts Farmers Markets, Whole Foods. You can even find Tahiti Trader Noni Juice at Amazon.com or TahitiTrader.com, or if you prefer the telephone, picking up the telephone and calling for more information or learning more about Tahiti Trader Noni Juice and what it could do for you in terms of circulatory improvement, and then something we just found out about, helping maybe kidney stones, who knows? You can call their number directly at 800-842-5309, 800-842-5309, or look for Tahiti Trader Noni Juice at your favorite health food store. All right, Larry, we've just got about a minute and a half left in the program. I want to, for those people who are just tuning into the program, kind of let you summarize what we've talked about over this time that went so fast. It just got away from us. What should people know about Tahiti Trader Noni Juice and how it can improve circulation?
Well, thank you, Dr. Bob. Basically, folks, Tahiti Trader Noni Juice is one of those amazing things that's going to improve your health. You're going to see it. You're going to feel it, especially if you have any kind of vein problems or these circulatory problems. You're going to notice your blood pressure is better. You're going to notice you don't have as much problems everywhere you go. You're going to notice it. You're going to feel it. And to make it work for you, I've got a very special Dr. Bob Martin special. I didn't tell people about this till now, Dr. Bob. We have a twin pack special that we're offering Dr. Bob listeners on our website, TahitiTrader.com, 2 bottles at 30% off and a copy of my book, Build an Amazing Immune System, together with our branded shot glass, which make it easy to get the right amount of noni juice for you for your application. You're going to love it. And it's a special offer only at TahitiTrader.com. The fun part about it is you're going to love the way you feel. And you're going to notice it every day. Guaranteed.
So, Larry, they're going to get the discount. They're going to get the shot glass, which they can put either noni or whatever they want in that shot glass, throw something back. And they're going to also get the book. Those are free with their purchase of the noni juice. Is that accurate?
That's true. A $20 value in addition to the money off. It's a very good program.
All right, ladies and gentlemen, go to TahitiTrader.com, TahitiTrader.com. Or for more information about this, if you didn't get that or you want more information, call them, 800-842-5309, 800-842-5309. Or if you can't wait, just simply go out to your health food store and look for Tahiti Trader Noni Juice or TahitiTrader.com for the special.
Thanks for tuning in to Wellness Made Easy. If you enjoyed today's conversation, be sure to follow our social media channels and visit TahitiTrader.com for more health resources and natural solutions. Until next time, stay well and keep making wellness easy.